Of actor Luke Perry from a stroke at age 52 is shocking news, but it highlights a disturbing trend, a rise in young Americans suffering a stroke. Fox Medical Team's Beth Galvin is here now to talk about this. And Beth, we tend to think about strokes affecting older people, but that's not always the case.
Yes, you know, we think about 65 and older, but really stroke can hit at any age. And a third of strokes happen in people under 65, and many of us don't even know that we could be at risk. But there are some changes that you can start making today to lower your risk.
Luke Perry's death at 52 from a stroke stunned many of the actor's fans. But Dr. Erin Anderson, an assistant professor at the Emory School of Medicine and neurologist here at Grady Hospital's Marcus Stroke and Neuroscience Center, isn't surprised.
Young stroke does happen. Usually we think stroke is a disease of the elderly.
Here at the Marcus Stroke Center, they treat about 1,200 patients a year. Most have suffered a major stroke that requires more aggressive, intense intervention. And Dr. Anderson says they're seeing a jump in younger stroke patients between 35 and 55 who are often unaware that they had an underlying problem like high blood pressure that could raise their risk of a stroke.
Blood pressure, I always say, is risk factors number 1, 2, and 3 for stroke. If we were able to not only diagnose blood pressure but treat blood pressure, we would treat and prevent probably 60 to 70% of strokes.
And Atlanta is along the stroke belt, where strokes are more common in younger people, especially African Americans.
It's typically the same risk factors: high blood pressure, diabetes, cholesterol. But what we worry about is that they're uncontrolled, they're undiagnosed, and when they go undiagnosed, you develop the complications earlier.
Dr. Anderson says if you can get to a healthy weight, get regular exercise, and stop smoking, you may be able to lower your blood pressure, cholesterol, and diabetes risk. But you also need to know the warning signs of stroke and act quickly.
It is very different than heart attack. With chest pain, people call 911, get to the hospital, get evaluated. But with stroke, you're right, it doesn't hurt. My arm, I think I slept on it funny. We hear a lot of different things of why people don't come to the hospital. We only have 3 hours to treat for stroke.
And they can extend that treatment window with some of the aggressive treatments like a thrombectomy, where they actually go in and pull a clot out. To try to remember the warning signs of stroke, think of the word FAST. So F stands for face. Ask the person to smile and look and see if the one side of their face is drooping. A stands for arms. Is one arm weak? S is for speech. Are they slurring or speaking strangely? Or are they having trouble understanding you speaking? And the T stands for time. A stroke is an emergency, and time is really everything. So you want to call 911 if you suspect that you or somebody you know might be having a stroke.
Very important. Yeah. So Dr. Anderson mentioned seeing more younger stroke patients. What kind of numbers are we talking about?
So we're actually talking about a pretty significant rise. The Stroke Association says there's been a 44% increase in the last decade in younger people having stroke. So at least we're talking about 30s, 40s, and 50s. That's pretty shocking.
Yeah,
44%.
It really is. Yeah, important to make sure it's taken care of early, like you said. All right. Thank you, Beth.